Hello, everyone. We thank you for joining us today, and we want to welcome you to the Benefits of Home Care webinar that we're having today. We hope that we'll be able to bless you with a lot of good information, and I hope in this time to give you a good idea of why home care can be a great solution, how to go about getting it and making decisions about it, and kind of looking at the entire financial landscape about getting care, the average cost of all the options, and how to drill down on how you can get your care paid for when you make your decisions. So again, we appreciate you joining us. I want to start with talking a little bit about why I got into this field, and I think I have a story that's not dissimilar from many of you who may be watching and listening to this webinar. I had a grandmother that, as she got older, needed more and more help. She actually ended up in a rehab facility, a nursing home, and my mother was trying to help her out, and the family was navigating her care needs. Well, my grandmother actually happened to get caught up in a situation where she got neglected and fell on the floor in a facility, and my family actually found her a number of hours later. And so we got her out of the facility and brought her home, but during that time, my mom had to care for her 24/7. And I watched as my mom tried to navigate the system, navigate the costs, and also deal with the personal stress of being a family caregiver. So it really set a desire in me and gave me a mission to get into this field to see if there are other solutions out there to really help the adult children navigate this, find peace of mind, and for people to be able to stay at home long term, which is where seniors want to be. So over 10 years of experience now in the senior care field after getting into it, watching what happened to my mother and grandmother, I want to lend some of that expertise hopefully to you today. So we're going to start with going through and evaluating the care options that are out there. And I want to talk through the different subjects that are on this page. We're going to talk about the comfort of being at home, why that is important, the importance of the feeling of independence that seniors have, the family involvement and the family dynamics that are often improved when the person and the senior is able to age in place. I really want to get a little more into the affordability of home care and how, by taking the right steps and making the right decisions, home care can actually save a lot of money versus some of the alternatives like facilities. We're going to talk about the health benefits and how by staying at home, you can actually have your senior both mentally and physically stay healthier longer term. There's tremendous peace of mind across the entire family when mom is there and she has the right caregiver. The daughter can go back into a situation of being the daughter again. So peace of mind is one of the top things on everybody's list, both the senior and the adult child. We're going to navigate through the flexibility and how you can use home care to your advantage to just pay for the care that you need. And last is safety. Done the right way, being at home can be very, very safe, and again, the person can stay there long term. So let's start with the pros of home care. You know, there's nowhere like home, and I've been able to do over 1,000 home assessments in my time, and it never ceases to amaze me that people have so much pride in walking you through their home, but sharing those memories that they have, whether it's the first house they bought when they got married, or this is the house where they raised their kids. This is the house everybody comes to for the holidays. This is the house that I've been growing and working in my garden for years and years. And although they've slowed down and although they need help, that same chair, that same cup of coffee, that same morning newspaper is extremely important to them. It's that familiar environment. It's no wonder that the AARPs reported that 88% of seniors want to age in place. It's very important to them. And it's the place they love. It's where all their things are, their memories, their photos, their recipes. And that is a key part, too, when you get a caregiver, because you want to encourage them to actually have the caregiver do some of the things they love. I mentioned the garden earlier. There's no reason a caregiver can't go out in the garden with the senior. There's no reason why they can't get out the old recipe book or get out the old photos and put them into photo albums. All those things and all those places help the person stay independent, but also help their peace of mind And really, their level of happiness is what can change. There's an amazing high quality of care that can happen one-on-one. I told you the story about my grandmother being in a nursing home. And there are good people in nursing homes who work them, but oftentimes the staff is left with incredibly hard ratios. It could be 15 to 1 on a floor where you have one aide who's navigating the needs of 15 others. Even assisted living facilities, the ratios are a little bit tougher. There's nothing that beats one-on-one care, not only in the social dynamic, but the care dynamic. There's a safe bath with constant monitoring, getting dressed, getting up and in and out of the chair when needed, even getting in and out of the car and going on errands outside of the home. The safety of one-on-one care you cannot replace. The health benefits are interesting to watch. In my experience and in many others, when people are able to age in place, it seems like, especially when it involves dementia and Alzheimer's, often people, although they don't improve if people have dementia, there is sometimes a bit more of a stabilization or less of a progression when people are able to age in place. Obviously, there could be a time when people go to a facility, but when people have some forms of dementia and they're jolted out of their home and put into a facility, the whole dynamic can change in the standpoint that every nook and cranny of the house they knew, when they woke up in the morning and knew the hallway to go through to navigate, getting in and out of the bath and shower, knowing every point there, even turning on their old TV and knowing where all the channels sit and everything else. There was a part of that that stabilized some of their cognitive ability. And when people go into a facility, there's a jolting that often can set them back, where we see spikes in dementia and Alzheimer's. Now, I want to say again, there is a time and place where they may need memory support or a facility. But I would keep in mind that if you're looking at the progression and worried about that, there is more of a stabilization in the home environment. Lastly, I want to talk a little bit about making the home safe, because that may be one of the most important things that you can do. There is a fantastic article in the Colorado State University Extension Journal, and instead of making a search for that, if anybody wants to email me at tom@carefamily.com, I'd be glad to send them this article. But in the article, it has a fantastic checklist of all the things you can do when you're walking through mom or dad's house. I'm not going to go through the entire checklist, but I want to talk about some of the things that are really important in keeping mom or dad safe. The first one I want to talk about is lighting. Oftentimes seniors will draw all the shades and keep lamps down. Where falls often happen is when people are getting up at night or going through hallways, or obviously going in and out of the bathroom. It's very important. One easy step is to make sure that hallways are lit, lamps are on, and lighting is very good in the house. The second very easy thing to do is do a couple things in the bathtub and in the shower or bathroom area that can save you time from a fall and the heartache of a fall. You know, Medicare will not pay $25 for a grab bar, $75 for a bath bench, but they will pay $15,000 for hip surgery. You want to avoid the hip surgery. But just a few simple grab bars that are put in strategic places in the bathroom, a simple tub transfer bench or a bath bench, and even a hosed shower head can make the difference of a long-term stay at home, safely bathing, and one where you could have a catastrophic event. So you want to make sure that bathroom area, getting in and out, is very safe and secure. The last easy tip is throw rugs. Falls often happen because seniors in their home have loved over the years having throw rugs, whether it's in the living room, in the dining room, or through hallways, where that's where oftentimes walkers get tripped up on, canes, or people just walking and slipping. And so, although it may be tough, changing a little bit of that environment with the throw rugs can be extremely helpful. Having a caregiver there is going to obviously keep the person safe. They're going to be able to guard against a fall, but also know if there's a fall very quickly, it can react to it. I would highly suggest that if you feel like mom or dad are a fall potential, that you look into a medical alarm if they're going at times without care. Very simple to put around your neck or put around your wrist. Philips Lifeline is an excellent provider of these types of services, and they run as little as $30 a month for a fully monitored fall detector. So I would suggest looking into that. Okay, I'm sorry about that. We're going to go to affordability. I want to walk you all through the landscape of costs of home care in America. And obviously people want to stay at home, but when you're making a choice about mom or dad, it's important you look at the full spectrum. Nursing homes are averaging about $230 a day for a private room, which is what most people want to do. The things to remember about a nursing home, they're high level of care. You don't have someone with you all the time, but you are getting 24-hour care and supervision. They're usually for people in a lot of need. I don't think I have to get in a lot of depth about nursing homes. I think people know what they are, and most people want to try to avoid them if possible, but there are a lot of nursing homes that do a great job out there. Let's talk about hourly care and home care, because that's when you start talking about, I want mom or dad to age in place and I want them to be there. You're looking at probably on average about $21 to, in some states, about $25 an hour. Some of that depends on the level of caregiver. A companion only, which isn't doing any physical or personal support, may be a little less. But you're looking in that $21 to $25 an hour range for hourly care with an agency. Can get expensive, but I'm going to talk a little bit about how you can use the flexibility of home care to save money. The next one is assisted living facilities. You know, in my area, the average good assisted living is about $4,000 a month, and that can be a nice option. I think the things to remember about assisted living is it's not total care. People oftentimes have to still do tasks by themselves. In some places, you have to dress yourself. You may have to bathe yourself, and you certainly have to be able to feed yourself food. So it's not a nursing home level. There is certainly not constant care, but it can be a good environment as well, but it is expensive for a good one. So you're looking at about $4,000 per month. CareFamily, which is an organization that we started here, the whole goal is to give people great caregivers at a very affordable price. So CareFamily, the idea is you're going and in your own area by going to carefamily.com, you're finding experienced, compassionate, pre-screened caregivers in your area to hire directly with the protections of an agency, like bonding, like insurances, like taxes. And it's a great way of leveraging costs to about $14 to $16 an hour. So if someone's averaging about 40 hours of care a week, you know, you're looking at, you know, it could be $600 a week as an example of care versus $230 a day or $100 to $200 a day in some facilities. So it can be an excellent option. I also want to hit one more area of affordability, which is live-in care, something we often do at CareFamily. Live-in care allows you 24-hour care in the home with a live-in caregiver, probably normally two who trade off, and the total cost per day while you're in your home with 24-hour care averages about $150 a day, and well below what you're seeing with nursing homes, and can be more affordable even than assisted living. But the best part is they get to age in place. It's a great way of leveraging costs, great peace of mind for the family, and again, it's a great opportunity for the daughter or son when they go over and see mom. They're not worrying about being her caregiver. They're actually get to be their adult child. So all those are good options, but when you see from the landscape, home care can be a great affordable solution. I talked a little bit about the flexibility question, and it's very important that when you customize your own care or determine what the care needs are, that you only pay for what you need. I always tell families when I'm working with them, you can always start with something small, make mom or dad feel very comfortable with it, and then upgrade as needed or if needed. A lot of times, many of you will be in a position where you're trying to convince mom or dad to do this. And it's good to be honest with them about what you feel and at times the peace of mind you need and the burden you feel by trying to care for mom or dad. But it's also important that it becomes their idea. They have some ownership. So usually that can happen by just getting a caregiver a couple times a week for maybe 4 hours a day. By doing that, you allow your parents to get much more comfortable with having a caregiver. And oftentimes we find, because you find that really good match, and we're good at that, that once you get the good match, it becomes a caregiver / companion / friend, and outings to, socialization in the home. Really important and creates a good relationship. But the nice thing about home care, again, if you need help in the morning to get mom up, to take her meds, to take a shower, but the rest of the day she's okay, that's all you need. You don't have to pay for 24-hour care. If it's more at night because she gets up a lot and either, may wander a little bit or is a fall risk going to the bathroom, you can do night care. You can even do a little bit in the morning and a little bit at night. So the nice thing about the flexibility and the options out there, especially with the CareFamily option over the home care company, is fit the care with your needs and with your budget, which you can do. The flexibility and the benefits of home care often include things like a reduction in rehospitalization. If someone goes to the hospital, the emergency room, or a rehab experience, and goes home unattended and with just family or friends stopping in, the level of rehospitalizations and readmissions is extremely high. And so we often suggest when you're talking to your parents or you're talking to the doctor or the nurse in a hospital setting, you think about how you can arrange even some short-term home care that can help bridge the gap over a couple weeks to monitor, to make sure things are okay, and to prevent that catastrophic fall or event that lands them back in the hospital, or even worse, in a facility that's very expensive long-term. So again, it promotes the healing and the safety that you need, and people can recoup better. Obviously, what's come up a lot lately, too, is infections, MRSA, different types of things going on in hospitals or facility settings. Obviously, the home setting is much more controllable, and caregivers are trained in uses of gloves and hand washing and things like that, which make the home environment much more safe as it pertains to infections. Obviously, the families love visiting the home. And oftentimes we see our caregivers helping mom prepare a meal or preparing a meal when the adult children or the grandchildren come over. They're still in that setting, in that environment. And not only does it give that senior that sense of independence and pride, but it allows the kids and grandkids to see mom or dad aging in place. So it's a great thing. I would continue to look at opportunities to use technology in addition to your staff. You're obviously, if someone needs care, going to need some sort of support from people. But, I feel like you can always use technology in addition to staff, which cuts the cost. I mentioned the alarm systems that can both monitor if someone falls, but also be a pendant that someone can push and talk to someone on a live speaker if they fall. Really important stuff. At CareFamily.com, you'll find in our own site things that will actually call seniors and alert them to take their medications. Because sometimes a caregiver has to be there just to make sure they're reminding people. Well, there's automated ways, like this med reminder system, to remind people to take medications. So again, the right type of cross between technology and physical care can give you a very budget-friendly way of keeping them at home. Also, more and more seniors are using things like Skype and video cameras to have a two-way conversation with their kids. And that not only increases the level of socialization, and in all of this being at home, you're trying to stave off that shut-in, depressed feeling. The combination of caregivers, Skype, outings, really does an amazing job of keeping seniors from being depressed. I want to move towards a conclusion with talking about paying for care. As many of you know, senior care, for the most part, is not covered by traditional insurance or Medicare. If you have Medicare, Part A, B, C, D, whatever it may be, oftentimes families feel like, oh, I have insurance. It's going to cover my needs as a senior. That, unfortunately, is just not true. It's one of the reasons long-term care insurance was invented. But you got to look at Medicare like a health insurance plan that covers hospitalizations, it covers sickness, it covers doctor visits, things like that. When it comes to I need help at home, unless there is an event that leads to physical therapy or wound care or hospice, there is very little home care support. And even in those types of examples I just gave, you may only get an hour or two visit a couple times a week. So sustained custodial personal care support is not paid for by insurance. So you are paying privately. For many, that's not an issue. But for a lot of folks, they're looking for ways to offset that if possible. So I'm going to take just a few minutes to go through some of these examples and explain what I mean about some of the things that are out there for people. And also point you on our site, and we will make a link available. But if you go to the CareFamily.com site and go to the resource area on the top of the homepage and go in, there is a white paper that is available that actually lists out all of these in more detail and gives you, it talks about 5 ways to save big on senior care. And it will go through these in more detail. Long-term care insurance is something that families buy. Sometimes people got it through a government job, or sometimes people bought it through a private employer. However, you usually buy it by yourself. And I'm assuming you know if you bought it, but it is an excellent option. I just made my mother buy it recently. And it actually is built to pay for care. You are pre-buying money to go to care. And if you haven't looked at it, the sweet spot to buy it is probably anywhere, in my opinion, between 50 and about 65, maybe 70. You have to look for it when you're healthy, because they won't write it if you have a number of chronic conditions. So the sooner the better, and the sooner the cheaper. And what you're doing is buying a certain amount of money per day, $100 a day, $150 a day, $200 a day, that can go for care. And that is enough to cover, 8 hours a day or a live-in caregiver. And it's an excellent way of hedging the risk of care needs down the road. Now, if someone needs care today and doesn't have a policy, it's not a big help to them, but it's adult children, I want to remind you it is an excellent option. Later in this presentation, I'm going to give you some great links to find long-term care insurance help. The next is reverse mortgages. Reverse mortgages are a government-regulated product that can be very advantageous to the right senior. Sometimes seniors are reluctant, maybe wisely so, to use equity in their home to pay for care. I'm going to tell you a brief story about a woman that I went to visit in her home. And unfortunately, the woman was wearing Ted hose, and her big problem was she could not get these stockings on her legs, which she needed to daily on a regular basis. She had other needs as well, but that was her big concern. I was in the home with this woman and her mother, and she was describing what she goes through every morning, and the fact that she wasn't able to put these Ted hose on correctly was leading to circulatory problems and falls. When we talked about what it would take to get a caregiver over, obviously the daughter felt like there was more that could be done, which there was. It could be a safe bath, it could be some late housekeeping, some meals, and some medication reminders, all really important. Well, the woman, when we told her, it would be, I think in this case it was, $16 an hour, she, for 4 hours, let's say a day, to do all the care that the daughter was saying, she started to cry. She said, I can't afford it, I live on Social Security, all this stuff. But I would love to get care like that. It's exactly what I need. Well, when we got talking, she talked about the fact she did not have a lot of resources, but she was in a very, very nice home that she had been in a long time. And the woman said, my mom owns her house outright. Is there something we can do there? And long story short, that is exactly what a reverse mortgage is meant for. And what the woman did by going to a reverse mortgage specialist was able to take equity out of the home, but basically have the bank give her a check every month. And she paid no closing costs up front. She basically decided to take $3,000 of money out a month to help pay for care and other things. And she had plenty of equity to last for years and years and years and years and still have something in that house to give her daughter. The great thing about reverse mortgage is you're never, ever kicked out of your house, even if you spend through the resources. So it can be a very, very good option. It is highly government regulated, which is excellent because you don't have to worry about the abuse that you may feel financially. It's a good, solid, trustworthy program. What you're going to want to check is the closing costs that happen at the end of when the house is actually sold or something happens at the end. But a senior can never be taken out of their house. And again, we'll have some links to that. Veteran Aids and Attendance is a program specifically for a veteran who served during a wartime period and his spouse. It covers the Korean War, World War II, the Vietnam War, and it's a very generous time frame, and it only takes 1 day during a combat period. Both the spouse and the veteran themselves is eligible, and too complex or too much information to give you in this one call, but I can tell you that if you are a veteran or the spouse of a veteran, even if the veteran has passed, you could be eligible for up to $2,000 a month in additional pension money. There are a little bit of income restrictions on it, so there is an application process that's going to check your financial situation. I will tell you, you do not have to be indigent or even poor, in a sense, to get this program. It's a pretty reasonable parameters about where you need to stand in your own resources in order to benefit from this. But it has become more knowledgeable in the base of the veteran community, the senior community, and thousands, if not tens of thousands of seniors are taking advantage of this on a yearly basis. And so we're going to give you some links for you to look at this, but if you are a veteran, it can cover your home care costs. One of the new ways of people utilizing care and having it paid for is the utilization of life insurance. That is not for everybody, but basically if you have a life insurance plan and you're willing to allow someone to take that plan over, you may get 50% of the value of that plan that you can put towards care. I'm not saying I advocate that, but that is becoming more of an option for people. And there's a company called Life Care Planning that you could look up online, and they do programs like that. The last is Medicaid, and basically if you feel like you're spending down your resources and you're at $3,000 a month for total resources, you could still own your home and your car. You could be Medicaid eligible, and by being Medicaid eligible, it will pay about 40 hours of care at home on a weekly basis, provided by Medicaid. The difference is you have to be Medicaid eligible. I put a website on here with where you can look more about Medicaid to find out. When is home care not the right solution? It's easy to say home care is the greatest thing in the world, but there are cases where a facility may be a better situation, and I've seen them all. When a senior is bedbound and cannot really get up and needs constant turning and is having skin breakdown, so needs turning, attention on the wounds, on the skin breakdown, and that constant monitoring, it could be better in a facility. That's what they're used to treating and doing. They have nurses there if need be, and there are staff there to constantly turn and reposition the client. The second would be when a senior has late-stage dementia and is a flight risk. We've had people who, unless someone is with them all the time, they can be a flight risk, and they can also, some can get highly combative. That's a tough situation for a caregiver to be in. It's certainly a tough situation for the spouse who may be living with them. So in that case, you may want to look at a memory support unit or a nursing home that specializes in this. Just a reminder that when someone is Medicaid eligible, they need to be homebound. And so if you're Medicaid eligible or you're homebound and need 24-hour care and have limited resources, Medicaid also will pay for a facility, so that may be the right move as well. On these pages, and you can look back at this webinar as we post it, you'll see places you can look on our site for videos and resources, and then as well as some of the links to long-term care insurance answers, the Veterans Aids and Attendance, reverse mortgage, and other things like that. So we thank you for joining us today. We look forward to hopefully if any of you have any questions, we do have an area of our resource site that allows you to submit questions. We would be glad to personally answer them for you. We may even make a podcast to share with others, not with your information, but the subject matter you asked to make it more clear to others as well. Also, remember CareFamily.com offers a great selection of support, resources, and caregivers in your area that help people stay at home long-term with very affordable live-in care and hourly caregivers. So again, I thank you for joining us today, and we look forward to talking to you again in one of our next webinars. Thank you.